Here's what we know right now. The CDC recommending that everyone in K through 12 schools wear a mask regardless of their vaccination status. That's big news if you're going back to school this fall. They're also asking people in areas with high COVID transmission rates to wear that mask even if they're vaccinated.
So what does that mean for us here in Connecticut? Joining us this afternoon, Dr. David Banach, an infectious disease specialist from UConn. Dr. Banach, thanks for joining us as always.
Thanks for having me on.
All right, so the CDC is saying even if you're vaccinated, mask up indoors in places with high transmission rates. So what does that mean for us here in Connecticut? Because we aren't seeing those high case numbers that other states are yet. For example, Louisiana or Florida. Should people wear masks indoors here?
So, I think, here in Connecticut, like you mentioned, we aren't seeing those high case rates. Really, the CDC is now identifying when transmission is substantial or high, indoor masking is recommended for all. Here in Connecticut, we fall into the low to moderate case range. So that recommendation doesn't necessarily apply here in Connecticut. What it does mean, though, is that we have to really be attentive to what we see around us. If we do see that cases are rising and that percent positivity continues to rise, we'll have to take the necessary action. But at this point, the main message is that these vaccines are really important here in Connecticut. We've gotten a lot of our population vaccinated. And that's really going to make all the difference in terms of mitigating the transmission here in the state.
So how bad is the Delta variant then here in our state? Should people start restricting what they're doing and who they're seeing, even if vaccinated?
So, the Delta variant, it is here in the state, and it does seem to be more transmissible than the previous variant. So I think we have to be mindful of that. I think in terms of protective measures, the vaccination is really the first and foremost way to protect yourself. These additional measures like masking indoors, distancing, they can be helpful. So, sort of be aware of your surroundings. If you're concerned that even if you're vaccinated, you may come in contact with someone who's particularly vulnerable, keep that in mind as you make your day-to-day decisions. But so I think, the keys are be aware, be mindful of what's happening around us and what's happening in your own personal situation to help you make those decisions about whether those extra layers are needed in your specific situation.
Yeah, that's good advice. So how common are these breakthrough cases that people are talking about? What are you seeing at UConn? Because the CDC said today they cited new information about the ability of the Delta variant to spread among vaccinated people, which is concerning.
Yeah, so I think what we're seeing with breakthrough cases are that they still remain very uncommon. If we look at kind of the grand scheme of things here in Connecticut, the number of individuals who do develop breakthrough infection seems to be very low. And amongst the hospitalized patients, exceedingly rare. We haven't had breakthrough cases in our hospital, but it's something that we're still keeping an eye on. So I think in terms of the big picture, the risk is low, but the risk is not zero. In terms of developing symptoms, most of these cases, tend to be very mild symptoms lasting for a shorter period of time. And overall, their infectivity seems to be less than the unvaccinated individuals. But, we need to be mindful. We need to, see what's happening both locally and nationally and, learn from that information and being able to make the best decisions to protect ourselves.
Okay, all important advice that you're giving us. Dr. David Banach, thank you so much for your expertise as always. And of course, here on Fox 61, we will continue following this breaking news from the CDC, the rest of the show and into the 5 o'clock. Dr. David Banach, thank you.